Welcome to another edition of the What is Global Health podcast. Today we'll be talking to Dr. Frederica Perera, an environmental health sciences professor at Columbia University's Mailman School of Public Health and the director of the Columbia Center for Children's Environmental Health. Her research focuses on using biomarkers and risk assessment techniques to investigate how environmental exposures to toxic chemicals and air pollutants can impact health, particularly child development. Dr. Perera's work has pioneered the field of molecular epidemiology, and she is the author of over 350 publications and received numerous honors. Thank you so much for joining us today. So, how do you use biomarkers to understand links between environmental exposures and disease?
Biologic markers help draw links between a particular exposure in the environment and a health outcome. Like, they're helpful because they can improve our assessment of exposure and actually, in some cases, give a measure of biologically effective dose, how much of the particular pollutant or chemical got into the body and hit a target, like DNA, for example. So they can help along with actual monitoring of the amount of pollution in the external environment, and they can also help with our understanding of the clinically relevant outcomes, because the biomarkers can include not only measures of exposure, internal dose, how much got in, biologically effective dose, how much actually interacted and damaged a key target, DNA, RNA, protein, and also some preclinical changes like a change in chromosomes or mutations in genes, or in a recent study we're just about to publish, telomere length, and help us to much better understand this continuum between exposure and disease or impairment. So it's a very powerful approach, and my colleague, Dr. Weinstein, and I proposed this back in the 70s when I was a graduate student, and did some first studies of it and using this approach, and it's been expanded on and adopted pretty widely, and we've been using it since in our studies of children and what exposures are affecting their health and development starting even before they're born.
And moving on, can you please describe your Healthy Home, Healthy Child education campaign?
Sure. So once we began identifying exposures that we could see were harmful, that were linked to problems in health and child development, and we wanted very much to alert not only our participants in the study, but also the community about these problems and what they could do themselves to reduce the exposures and the harm, and what they could do in their own lives, in their homes, in their lifestyle, in their even their consumer habits in terms of, and food was very important. So diet, a lifestyle habit, very important to understand what dietary factors are healthy and what are not. Of course, smoking we know is detrimental, active smoking, but many of the women in our community didn't understand about secondhand smoke, the need to ask people to take the smoking outside if they were household members, and not to smoke in their presence or their children's presence. Healthy, safer cleaning products was another area, proper ventilation when cooking. There are many tips that we have been passing on to our participants and to the community, and our materials are in Spanish and English. And then I mentioned web-based, and we're looking into apps that could be used with mobile technology. But of course, many of the pollutants we're dealing with are not things that can be necessarily well controlled by individuals. So air pollution is an example. Yes, there are things you can do in the home, and I mentioned them, a few of them. But ambient air pollution needs to be regulated and controlled by the government, and that's very important. It's been shown to be very effective in bringing down levels of pollution and levels of damage.
Yeah.
So just on that topic about suggesting new policies to decrease these air pollutants. So recently, back in November, you and your team of environmental health scientists from the Mailman School joined with Chinese researchers and officials in Beijing to discuss ways to curb these environmental threats to health. So what are some major issues regarding air pollution that were addressed during this meeting?
Well, the meeting was wonderful. It was a workshop of some 50 people. There were academics and other scientists. They were government officials, members of the Chinese CDC, for example, Centers for Disease Control, and non-governmental organizations that are very knowledgeable about pollution, particularly air pollution, fossil fuel pollution, and health impacts, and then policies that can or have been shown to make a difference. Now, this workshop was informative, helped us to think about and strategize about a conference that will be held sometime next fall, we believe, that we're sponsoring with Chinese colleagues and institutions there. It will be an international conference to talk about these issues of pollution, health, and policies. And we really want to present examples of successes, case studies of successful policies and initiatives that have worked and been effective. And in that way, describing them, it's the good news that there are solutions, there are opportunities, and they can be extremely advantageous, not only bringing benefits to health, but also to the economy. So that's our rather ambitious goal, and this workshop helped us to think more deeply about it and how we would want to proceed.
So what are some examples of policy changes that can combat these pollution problems?
Some of the policies that were discussed were various, and they're complementary, they're not mutually exclusive. So, of course, pollution control has been practiced around the world, and there was a great deal and new technologies to control the emissions from combustion sources or from motor vehicles. But really, the emphasis was on preventing these pollutant emissions in the first place, and there was much discussion about renewable sources of energy, solar, wind, even hydropower in some settings, and also conservation. Then there was a great discussion about sustainable urban development, cities that are low energy in the sense of the transportation systems, allowing walkability. Children should be able to bike or walk to their school and not have to go across highways to get there and breathe pollution. And a number of cities have taken great steps to reduce pollution. And I'll come back to why concern about children and the young looms so large. Also, sustainably built buildings and managed buildings. Buildings are a huge sink for energy and source of pollution. And basically shifting to a low carbon economy. That term is widely used. And in the commentary I published recently in the International Journal of Environmental Research and Public Health, I summarize solutions that have been actually tried and have been shown to be successful, and given some of the numbers on the economic benefits, not only do these policies to curb pollution, switch to clean energy, renewable sources, and so forth, do they benefit health? And not only the health of adults in terms of fewer heart attacks and cases of cancer. These are the generally measured outcomes for benefits, economic analyses. But we also cite and are working on monetizing benefits in terms of fewer impacts on children, starting when they're exposed prenatally, and and impacts that if you prevent them, those benefits will play out over the entire lifetime of the child.
Mm.
And there are enormous economic payoffs, like in gain of IQ. That means bigger lifetime earnings, greater potential to contribute to society. So everybody benefits there. Just those very limited economic benefits analyses have yielded benefits in terms of billions of dollars, and with a ratio between what has to be invested to clean the air and control pollution, eliminate it, and what the benefits are. And so there's one very often cited example of the Clean Air Act amendments in the U.S.,
Mm-hmm.
and there the avoided health costs are estimated at $2 trillion by 2020, so 2 years from now, and a ratio of $1 in cost to $30 worth of benefits from that investment, from investment in clean air policies. And then another number is 250 billion a year predicted by 2030 in avoided health costs from clean energy just in the US. And from the California Climate Change Program, just this one forward-looking state, they have estimated a $76 billion increase in the GDP of the state.
Oh wow! Just in California.
Yes, just in California, and so these are very large numbers, and I contend they're underestimates. But even as underestimates, they're impressive, and they should spur us on to do more and to think holistically about air pollution, and particularly they're harmful to not only low-income populations who are less buffered and protected, but also to the young, even the developing fetus, young child, because of the extreme biological vulnerability during those early stages. They just don't have the same mature biological defenses, the same mature immune system, the ability to detoxify and clear chemicals. And so we need to take many more steps to protect this very vulnerable group, disproportionately vulnerable group of the population. Because as I mentioned earlier, by protecting the very young, we protect everyone, including other susceptible groups and the elderly, etc. But there have been studies suggesting that air pollution decades before older age in adults, air pollution is a risk factor for neurodegenerative disease, dementia. Even some studies suggest Alzheimer's. Take all of this together, you can see that there are great benefits, and it's an opportunity. And the Lancet Commission that I was on, that just recently published a report on pollution and health, talks about the challenge, but really about the huge opportunities that exist. Probably the number one public health opportunity of our lifetime to address these joint problems of pollution and climate change.
So these policies have huge potential to protect people of all ages and to benefit the economy too.
Yes, and it's an environmental justice issue, as I mentioned, because it is lower income populations all around the world, and even in developed countries, low-income populations and communities of color tend to be more affected because the exposure is higher due to siting of polluting sources in their areas, and also because, as I pointed out, they're less buffered perhaps by things like good nutrition and good social support and good education and remediation for children who have problems. So it is clearly a question of rectifying the tremendous inequality that we see worldwide and right here in our country.
Just building off what you said about socioeconomic status, what would you say about links between genetic and socioeconomic predispositions with greater vulnerability to these disease developments?
Well, there's a large literature showing that, and some studies that we ourselves have done, that genes that by themselves would not have an effect on health can act in conjunction with, can interact with pollutant exposures to cause serious damage. And that's been shown again and again. And a lot of the times these genes play a role in the detoxification of pollutants, in the repair of damage to DNA. They may prevent oxidative damage, which is one of the means of mechanisms, by which these pollutants can act. Okay. We also showed in a very recent paper that it was the children of mothers who reported suffering material hardship during pregnancy in the child's early years. That is not enough food, shelter, clothing at some point or points during this early window, and who had higher exposure to prenatal exposure to PAH, these hydrocarbons that come from combustion, motor vehicles and oil burners and power plants and such. It's those children who had greater number of problems with ADHD. And ADHD is the leading behavioral problem in the U.S. neurobehavioral problem. Has a tremendous cost in terms of that individual child's ability to learn and to contribute to society. So when the children had both of these insults, socioeconomic deprivation and higher pollution exposure, they were more affected by in terms of the outcome of ADHD. Others, the data indicate that we need to act on more than one front, on obviously pollution, but also on socioeconomic inequality, provide the support that is needed.
So just one more question.
Okay.
So what do you find most rewarding about your work?
Well, I find it very rewarding when we can actually demonstrate the benefits of some policy. And we've done that in China in a study in a city where a power plant, coal-burning power plant, was highly polluting and was closed down, but not before we had enrolled a group of women who were pregnant at the time of enrollment, about to give birth actually, and followed them and their children for several years. And then we enrolled another group of mothers and newborns who did not have this exposure because the power plant had shut down before the children were conceived. So we have two groups, identical in every way. They live in the same community, same ethnicity, same socioeconomic level. And we compared a number of things. We compared air quality, monitored air quality during those years before and after the plant shut down. And guess what? The air quality improved. The levels of the hydrocarbons, PAH, that we're interested in dropped significantly. We compared the levels of damage on DNA in cord blood from the same pollutants before the power plant shut down, after. That was a nice story because the levels of this DNA damage also dropped significantly. We looked at a protein that's really important in early brain development called BDNF in cord blood, and that in the second cohort, the levels were higher, signaling that that good protein was higher after the plant shut down. And we finally, there were a number of other things that we looked at, but we've also looked at telomere length, or people pronounce telomere, usually, length, which are caps on chromosomes in the newborn cord blood, comparing before and after the plant shut down. And the telomere length was increased in the second cohort. And that's a good sign for health and longevity. It's a general kind of a marker. And moreover, we had seen that in the first cohort that children who had higher levels of the exposure prenatally did not fare as well in terms of their cognitive development. In the second cohort, the levels of that marker of exposure had come down, and we didn't see that clear association. So there were good news in a number of ways, and that gives us, me and my colleagues, enormous satisfaction and optimism, and we want to tell more of those stories.